Today we're conducting another in our series of ESCRS Heritage interviews. I'm joined by Patty Condon and Richard Packard, two pioneers in ophthalmic surgery, to discuss Dr. Condon's new book, Eye Healthcare, A 90-Year History of Progress.
Patty, it's good to see you here. I read the book. It's an impressive history of what you and your dad got up to. You were instrumental in getting ESCRS from a relatively small group in the 1980s to the major international meeting as it is now. Did that surprise you that this is now the largest anterior segment meeting on the planet?
Nothing surprises me about the ESCRS. It's a wonderful organization. But it started with a great heart, and I think we owe so much to Vinkhorst and then Ridley as well. And Peter Choice. I think those three people were remarkable people. They've just revolutionized the whole treatment of cataract. It was wonderful to know them all personally.
In the early days, for both you and your father's experience, it seemed to be a terrific uphill struggle. What would you say was the greatest challenge?
And I was very fortunate, and I think my father was also very fortunate in a smaller way, that we were able to have our own separate departments within a general hospital. And we were independent from the management, from the secretarial point of view, from the theatre point of view, from the nursing staff point of view. The moment that the unit was scrapped and we moved into a general hospital environment, then, of course, things started to crumble. We had lost control of sending for our own patients and bringing them into our own bed situation and being able to operate when we wanted to operate. Because we found that there were other surgeons who wanted our theatres when we wanted them. And as a result, we now had a national treatment plan from the government deciding that they would actually send our patients to a private hospital to get them treated. We lost a lot of patients, we lost a lot of kudos, and we lost a lot of morale in the unit. And I think this is one of the big problems with the National Health Service and also with our services. Bureaucracy has taken over the management of patient management. Consultants have lost a lot of power, and there's a constant battle all the time with funding. National Health Services really should be taking a lesson from the private guys and setting up their own clinics for their own patients instead of sending all out to these private companies who are making a fortune.
Yes, indeed. Now, let's take you back a little bit. When did you move on to phaco?
Phaco, as you know, started in the 70s with Charlie. I went to see Charlie around the early 80s.
Was in New York?
Yeah, that of course was a great experience. And then subsequently, I went to see yourself and Eric Arnott operate. I think one of the interesting things about introducing phaco in the UK, I recommended it at a council meeting in UCAS that this should be taught to our junior doctors in all the eye departments in the UK, and it was greeted with total skepticism and saying, this is totally impossible. Nobody has a phaco machine. I said, we all ought to get them now pretty quickly and start working with them,
Well, I certainly remember that these incidents where people would look at you strangely when you suggested this. And when did phaco really take off in Ireland as a whole?
I remember there was a lot of interest in it, and they came down to watch us doing it. And eventually I took a group of them to see Howard Gimble in Calgary. It was the occasion of the American Academy meeting, and we took the detour there. But we had great fun, and Gimble was fantastic. His whole theatre setup was amazing. It was really an experience for all of us Irish surgeons to go and see him, and that's when the whole thing took off, because everybody could see that this was the only way it was going to go.
Before that, you had a big interest in corneal surgery. Do you want to talk a little bit about that and tell us what
Yeah, I tell you, one of the things that really stimulated my interest in corneal surgery was that I got sent a lot of desperately advanced cases of keratoconus in young people, and they had been partly fitted with contact lenses, but there were some of them that you could not do anything for. In desperation, I did a lot of penetrating corneal grafts on them. They did very, very well, and I think the reason they did go well, apart from the surgery, was because the donor material was very good.
Where did you get it from?
Locally. in our area, I set up a eye donation scheme amongst the general hospitals. We had, at that time, several nuns working as nursing sisters in our hospital, and they took on the onus of interviewing patients when there was a death in the hospital as to whether they would like to donate the patient's eyes. And in that way, we set up quite an active donation scheme. When Jacob Creutzfeldt came in, our government decided no way that we can use Irish donated material, and they banned it.
So where'd you get your funds from?
Colorado, which was supposed to be a Jacob Creutzfeldt virus-free zone in the United States. They've now debunked the whole theory of the virus causing any contamination from corneal transplant work. Up to this moment, we're still bringing corneal material from Colorado, but it's all going to change in the next month or two, in that they have set up now their own eye bank again in St. James's Hospital in Dublin. Some of the cases, the advanced cases of keratoconus, were really very advanced and were tragic. There was nothing you could do for them at one stage. But at the end of the book, in the last chapter, I've a small section on intracorneal rings being used in conjunction with cross-linking for advanced keratoconus.
Susan Jacob concept.
Yeah, and I think Saoirse Dougal is also involved in doing some of these cases as well.
Yeah.
So the whole management of keratoconus was a big problem in those early days, and that's one of the most major advances that I can see that has happened in recent years.
Now tell me, what do you think was your greatest achievement and what you and your dad actually got up to in the southeast of Ireland?
I think one of the things that I was very proud of was setting up a charity for prevention of blindness. Before laminated windscreens were introduced legally,
yes,
there were no seat belts at that stage, so they went straight through the windscreen.
Yeah.
But they were horrific accidents, and in fairness to several people in Ireland, we managed to get the legislation introduced in Ireland as well, and that saved an awful lot of these eyes. We also did a lot of work with diabetic retinopathy, setting up screening clinics, and also glaucoma screening services as well. They now have a national screening clinic, which is paid for by the government. We did all this on funding made up, raised locally. But then the major one the charity achieved was the setting up of a national eye bank for donor eye corneal transplantation.
You have very kindly decided to donate anything by way of funds that you get from selling your book to the Ridley Foundation. Do you want to talk a little bit about what the foundation gets up to?
At the moment, treating cataract blindness and generally providing a service of ophthalmology to the people of Nepal who live at very high altitudes. They run about 12 cataract camps a year. Involved in that are about 2,000 patients, generally screen them, and they did about 800 to 900 cataracts procedures. It's a very rewarding charity to contribute to, and I know for sure that the ESCRS has donated quite a few cataract camps themselves.
Paddy, it has been great to talk to you. I think your book is really, really interesting. The struggles that you and your father went through are just a wonderful testament to the sort of heart that you brought to the whole thing. So very good to see you, and carry on with your work. And I hope that the book does really well with the Ridley Foundation.
Thanks very much, Rich. Thanks, Sean, very, very much indeed.
Thank you so much.
It's a pleasure.
Thank you for joining us. For more information on this and related subjects, visit us at escrs.org, particularly the Heritage section.